A very good morning to one and all. Today we are going to discuss about the topic ototoxicity. Let me introduce the topic. Ototoxicity is quite simply ear poisoning. So ototoxicity we can call it as ear poisoning. Auto means ear and auto the word is related with ear. Toxicity means poisoning, which results from exposure to drugs or chemicals that damage the inner ear or the vestibulocochlear nerve. So, what is happening in this ototoxicity when we are exposing to drugs or chemicals? So, we are taking in some disease conditions, we are taking medications for that systemic medications. We are taking some antibiotics. We are taking analgesics and all taking. Not only this is not only for ear, but we are taking for some other systems. Then also, if we are exposing to drug or chemicals that damage the inner ear, it will damage the inner ear and also vestibulocochlear nerve, the nerve sending balance and hearing information from the inner ear to the brain. So one function of the vestibulocochlear nerve is the nerve which sending balance and hearing information. It is a nerve which is sending the information regarding balance and hearing of the person to the brain. So this is a introduction of ototoxicity. Let us see the definition. Ototoxicity is the damage caused by the toxic effect of certain drugs to either cochlear or vestibular or both part of the inner ear. So cochlear and vestibule, these two things are the function of these two things are last classes also we discussed that balancing and hearing. So the both functions are taking care of inner ear. Okay. So here what is happening because ototoxicity is the damage caused by toxic effect of certain drugs. So it is the main cause of this ototoxicity. Only cause is exposure to drug and chemicals. So what is happening to either cochlear or vestibular or both part of the inner ear. So because of exposure to drugs, if there is any damage is occurring to the cochlea or vestibule of the inner ear, that we can call it as ototoxicity. It can be temporary or permanent. Sometimes this ototoxicity will be temporary and sometimes it is permanent. So once that effect of the drug is minimized or eliminated from the body, that time some of the signs or symptoms will be reducing, or the person will relieve from hearing problem or balance problem, or in some time it will be a permanent problem. The effect of certain drugs is often temporary, while other drugs typically produce permanent changes to the ear. So some drugs effects are temporary, but some drug effect will be permanent defect occurring to the ear. Some drugs can cause either temporary or permanent problems. Let us see the anatomical structure of the inner ear. So here you can see the we have already discussed about this particular topic. You can see in inner ear what are the structures are present. So cochlea and you can see in that vestibule. These are the two organs which is helping for hearing and balancing. Let us see the list of ototoxic drugs. Okay, what are the ototoxic drugs which can lead to ototoxicity? Aminoglycoside antibiotics, the antibiotics which is contain aminoglycoside, loop diuretics, then cytotoxic agents. Example anti-neoplastic drugs, drugs which you are using for cancer treatment, anti-protozoal for protozoal disease, which drugs we are using like malaria, anti-malaria drugs, anti-epileptic drugs, anti-heparinizing agents means to in order to prevent the clotting. So that drugs, beta blockers and environmental chemicals. So these are the certain drugs which can lead to ototoxicity. Okay? You just go through the drug book. I think you have studied in pharmacology about these drugs. Go in detail. So we will discuss one by one. Aminoglycoside antibiotics. All members of the aminoglycoside antibiotic family are well known for their potential to cause permanent ototoxicity if they enter the inner ear. Some of these drugs are more likely to cause hearing loss. Others are more likely to cause vestibular loss. Others can cause either problems. So aminoglycoside antibiotics are well known for ototoxicity. They are more potential for ototoxicity. Maybe it will be permanent ototoxicity once it is enter the ear, once it's crossing the ear barrier, or once it is circulate through the ear, then it can lead to ototoxicity to the ear. And some of the drugs are most likely to lose hearing loss. and others are for vestibular loss. Any one loss will be there. Either it will affect the hearing or either sometimes it will affect the hearing balancing. Okay, sometimes both will be there. Then amnoglycoside antibodies can either the inner ear can enter the inner ear through the blood system or via diffusion from the middle ear into the inner ear. So some of the eardrops are containing amnoglycoside. So that is a cause for entering the amnoglycoside into the ear from the middle ear to inner ear, because the tympanic membrane is having a permeability. So through the tympanic membrane, the drops which are instilling in the ear can enter into the middle ear, and if it is extra dosage, then it can also enter to the inner ear. And other mode of entry is through blood system, through the circulation. They enter the bloodstream in largest amounts when given intravenously and in the least amount by pills. So if you are giving aminoglycoside intravenously for any other condition, it can circulate to entire body and it will reach the ear, and least by pills or tablet. Example for aminoglycosides are amikacin, netlimicin, dihydrostreptomycin, ribostomycin, gentamicin, streptomycin, kanamycin, obramycin, neomycin. These all are aminoglycoside content. So this medicine can lead to ototoxicity. Next one is loop diuretics. Loop diuretics are a specific family of water pills. They are otherwise known as water pills, known to occasionally cause temporary ototoxicity. This drug cause ringing in the ear or decrease hearing that reverse when the drug is stopped. So loop diuretics mainly we are using for eliminating the water content or for balancing the water content in the body if excess production is there. So some of the loop diuretics can lead to decrease hearing, and in this condition it is a temporary ototoxicity. So once we stop the loop diuretic infusion or administration, then the ototoxicity will be reversed. The examples are bumetanide, ethoxycrinic acid, furosemide, torsemide. Next one is cytotoxic agent, that is anti-neoplastic drugs, which drugs we are using for cancer treatment. Anti-cancer drugs works by killing cancer cells. Unfortunately, some can also damage or kill cells elsewhere in body, including the ears. So as we already know about the treatment of cancer, the chemotherapeutic drugs which we are using, that is called anti-cancer drugs. So this drug is having a action, that is it will kill the cancer cells along with means normal healthy cells. So both normal healthy cells and cancer cells both will destroy, and it can affect anywhere in the body. So sometimes it will include the ear. Cisplatin is well known to cause massive and permanent hearing loss. Carboplatin is also known as to be ototoxic. So some of the example are nitrogen mustard, cisplatinum, or carboplatin. These are the medicine which can lead to ototoxicity or permanent hearing loss. Then antiprotozoal drugs which we are using for treating protozoal infections. Aspirin and quinine, aspirin, acetyl salicylic acid, and quinine are well known to cause temporary ototoxicity resulting in tinnitus. Quinine we are using for malaria treatment. They may also reduce hearing, particularly when given at high dose. So the problem is when we are giving for high dose, if the recommended dosage is increased, okay, more than that if you are giving, then it can lead to this kind of ototoxicity. Quinine products can also temporarily reduce balance ability. Once aspirin or quinine is stopped, the ototoxicity generally disappears. So maybe if you are taking a history about the malaria patients, they maybe tell that they are feeling some kind of balancing dysfunction. They can't able to stand, or they are feeling fainting and all. This all happening because of the temporary reduction in balance ability. Some quinine products are chloroquine, quinidine, quinine, tonic water. These are some quinine products. Then anti-epileptic drugs like phenytoin on sodium, then beta blockers like propranolol, then environment. These are the drugs. Then environmental chemicals means have long been implicated in ototoxicity. Little research has been done to substantiate their precise effect on ears, but most are associated with hearing disturbance that may be permanent. In addition, mercury. Here, environmental chemicals have long been implicated in ototoxicity. They are more potential for ototoxicity. Okay, there are so many research have done to identify the precise effect of the medicine or of the chemicals related with the ear. Most of them are associated with hearing disturbance that may be permanent. So, example we can see in a butyl nitrate, mercury, carbon disulfide, styrene carbon monoxide, then manganese silane, lead, and tin. So, these are certain examples. Route of access. Ototoxic effect can be produced usually by parenteral administration, oral administration, or topical application to ears, wound, burns can also cause ototoxicity. So, how this medicine is or how the ototoxic effect is producing the body. So, the main route of access are oral administration, topical administration, application mainly to the ears when we are applying to the wound, burns can also cause ototoxicity. Then, parenteral administration means the IV route, intravenous or intramuscular. Signs and symptoms range from mild tinnitus to total hearing loss, depending upon each person and the form and level of exposure to the ototoxin. Depending on the exposure to form and level of the exposure, it will be changing from mild to total hearing loss. Then they can include one side or two sided hearing loss and constant or fluctuating tinnitus. So these are the signs and symptoms. And along with this one, high pitched tinnitus is often the earliest symptom. So inside their ear, they can hear a ringing sound, high pitched ringing sound. Then sensorineural deafness and vertigo, balancing deficit. Then how we can assess the and diagnose the condition mainly based upon patient history, symptoms, and test results. So we have to collect the history, proper history about the person, whether they are used any kind of ototoxic drugs, whether they are having any previous usage of any of the drugs or exposure to chemicals or environmental things. Then there is no specific test for ototox. There is no specific test to identify ototoxicity. This make a positive history for ototoxin exposure crucial to diagnosis. Here we can see one of the tests is electrocochleography. That is also not for identifying ototoxicity. It's a technique of recording electrical potential generated in the inner ear and auditory nerve response to sound stimulation using an electrode placed in the ear canal or tympanic membrane. So this is mainly we are using for identifying the sound stimulation or response auditory nerve response to sound stimulation, whether the auditory nerve is responding to sound stimulation or not. Then electron stegmography, so that will help to identify the eye movement, whether the sound whether the eye is responding to the sound. Then auditory brainstem response. These are the tests we are doing for ototoxicity. Next one is a treatment. At present, there are no treatment that can reverse the damage. So we have discussed that it may be temporary or permanent damage. So in temporary damage, it will be reversed once medicine effect is reduced from your body. But in permanent means there will not be any reverse. Currently, available treatment focus on reducing the effect of the damage and rehabilitating function. So only the treatment is we are doing for reducing the effect of the damage. So if they are having some kind of hearing loss or some impairment, that particular problem we can reduce, the effect we can reduce, and also we can provide some rehabilitating function. Medical or surgical treatment is usually not effective. Use of ototoxic drugs should be avoided whenever possible. So there is no effective medical or surgical management for ototoxicity because there is some kind of destruction happening inside the vestibular nerve. So if something happen in the nerve, then there will not be any surgical manifestation or any intervention for that. So only the thing what we can do is use of ototoxic drug should be avoided whenever possible. Whenever possible, we have to avoid the use of ototoxic drug. Specifically, individual with hearing loss may be helped with hearing aids. Those with profound bilateral hearing loss have been shown to benefit from cochlear implants. So, specifically, we can provide some hearing aids. Individual with hearing loss may be helped with the hearing aids. Hearing aids we can provide. It will helps to improve the ability of hearing. And profound bilateral hearing loss have been shown to benefit from cochlear implants. Okay, cochlear implants also is available as a part of treatment. Then usual treatments given for sudden sensory neural deafness can be advised. Withdrawal of ototoxic drug may prevent further damage in early cases. So, if the person is having some symptoms of ototoxicity in the beginning or in the earlier time, we can stop the ototoxic drugs or withdraw from that. It will helps to prevent from permanent defect. Hearing aids are advised in clients with established deafness. If completely deafness happen, then we can provide some hearing aids. Cochlear implants clients with profound bilateral sensorineural deafness. Cochlear implant we are advising for patients who are having profound bilateral sensorineural deafness, means both ear deafness is there. Then we can provide cochlear implant. So these are the treatment we are doing for ototoxicity. So these are the hearing aids we are giving. Maybe some of you have seen. Then cochlear implants are there, so that also helps for increasing the sound or that hearing ability. Let us see what are the health education for patients, those who are using toxic drugs. Advise a patient to avoid toxic drugs. Advise patient to avoid intake of drugs without prescription. So proper prescription is needed always. Sometimes maybe we are also approaching the pharmacy or medical shop for getting some medicines for a instance relief. Sometimes these medicines may be a autotoxic, so we should always carefully we have to handle the medicines which we are taking without prescription. So always you have to follow a prescribed medication for your problems. Ask patient to avoid toxic drug if they are taking any other toxic drugs. So if already they are taking some toxic drug, then they tell them to avoid to extra dosage. Advise patient to avoid contact with environmental chemicals. So whenever you are exposing with environmental chemicals, you always protect your ears from entry of environmental chemicals. Teach patient about importance of taking medicine according to the prescription. Okay, so these are the certain health education which we can provide for autotoxic drugs. So this all about the topic autotoxicity. So today we discuss about what you mean by autotoxicity definition, then what are the drugs which can lead to autotoxicity. That is the same thing causes. Then we have seen each drugs in detail. Then what are the signs and symptoms we can see in autotoxicity. Then what are the diagnostic tests? Then what is the management for autotoxicity? Finally, we provide a health education. So this is all about the topic autotoxicity. I hope all of you understand about the topic. Have a nice day. Thank you.